Hi, how's everyone doing? My name is Brian Furla. This is my video presentation over the National Asthma Education and Prevention Program, or the NAEPP for short. For the outline for the presentation, we'll be going over the diagnosing and managing of asthma. We'll be referencing the guidelines from the NAEPP Expert Panel Report number 3, as well as going over topics of goals of the quick reference guides, which would be your quality asthma care, what asthma control is indicated, achieving and maintaining asthma control, and then we'll have a few diagrams at the end to review as well. So what is the NAEPP? They are a organization that raises awareness among patients, healthcare professionals, and the public that asthma is a serious chronic condition. It ensures the recognition of the signs and symptoms of asthma by patients, families, and the public, and the appropriate diagnosis by health professionals. So they ensure effective control of asthma by encouraging a partnership among patients, physicians, and other health professionals through modern treatment and education programs, enhancing the quality of life for patients with asthma, reduce the burden of asthma, and reduce the number of asthma-related deaths. So the public's very misinformed or uneducated on the matter. People that think they have asthma are just going to be these small little kids and they'll grow out of it, or they'll, get a little bit stronger. And most of the time, some patients do, but asthma-related patients, they have this condition that is for a lifetime or for most of their life as they're young adults as they grow older. But it's a serious issue because it can affect their daily lives. It's good to be aware and have that education because you should know, let's say you have a friend, classmate, coworker, and if they have allergic reactions and they're pretty sensitive to, having that awareness and what to do and what not to do around those people could really help save them a trip to the hospital or even worse. So the membership of the NAEPPCC is a federal asthma advisory committee. They comprise representatives from the federal agencies, medical associations, voluntary health organizations, and the community programs that seek to educate the public. Because once in a while, we always hear those stories of kids or adults even that were subject to either a form of bullying where the kids didn't understand that these kids could be a little bit different in that sense. They have to have that special care, that extra special attention, and to be very careful with what their triggers are. And most kids, even people that have asthma, if they're not given the proper education, they are not even told how to use their inhaler correctly. And I've seen that so many times in a clinical setting as well. So the diagnosing and managing of asthma. The goal of this asthma care quick reference guide is to help clinicians provide quality care to people who have asthma. We've seen it many times before. Doctors that are a little bit older or doctors that are misinformed, because at the end of the day, it's not as though this is a big topic of discussion for them as well, since they have to move through their studies as well. But asthma, it is a serious condition which could be misinterpreted and misdiagnosed. So quality asthma care involves not only initial diagnosis and treatment to achieve asthma control, but also long-term regular follow-up care to maintain control. And what does that mean? So patients need to understand that this is a life-changing event that also changes throughout their years. So they need to be aware of their own triggers, how severe their triggers are, such as, me personally, I have allergies towards, pet dandruff, outside pollen, but I don't get flare-ups to the point where I have bronchoconstriction, so I don't have asthma. But I am aware of what could give me, those allergic reactions and how severe they can be. So a patient with asthma needs to be aware that if they're in an event where it could progress worse to, a total block off of their airway, and then they're in big trouble. They didn't know what they can do, such as an EpiPen, their rescue inhalers, and stuff like that. So asthma control focuses on two domains. One is reducing impairment, so their frequencies and intensity of symptoms and functional limitations currently or recently experienced by a patient. That's what I was mentioning before. They didn't know how often are they going to experience this, because I've seen patients come in and they're like, yeah, I use my emergency inhaler, my rescue inhaler 4 times a day. And then it's like, okay, well, you need to understand that even though you're doing all that, there's a chance that your body is growing accustomed to that type of negation. So then your body doesn't try to fight off that triggers very well. And next thing you know, 4 turns into 6 times that you're using the rescue inhaler. So you also want to do, as a patient or as an RT, you want to help reduce those risks. So the likelihood of future asthma attacks, progressive decline in lung function, or for children, reduced lung growth or medication side effects. So this is kind of diving to what I kind of talked about a little before there, that, the likelihood of future asthma attacks, it's going to grow greater because, again, your body's accustomed to this daily reaction to this asthma attack that you are fully aware of, but you're subconsciously putting yourself in a state where you're having that done to yourself. So, but you're unaware, or you're not very caring, as a little kid would be. They're not very aware and understand the symptoms that happen along with that. So then they progress to a decline in lung function. And since they're young, or if they're young enough, they have stunt growth. So their lungs are just growing stiffer, or their lungs are like, I don't want to, I don't want to get older. I don't want to grow more, and they start to stunt their growth. So that's to keep an eye on. Medication side effects, albuterol, it raises your heart rate. It doesn't taste that great. Kids don't understand that. They take it and they think it's bad for them. It's not. It'll help them in those one-off attacks, or again, their mini attacks that they might have in a day. So achieving and maintaining asthma control requires providing appropriate medication, addressing environmental factors that causes worsening symptoms, helping patients learn self-management skills, and monitoring over the long term to assess control and adjust therapy accordingly. So the goal for the organization is to help improve education towards everyone involved in that field. So that means that doctors and RTs, nurses, whoever the person is at the time, even the patient themselves, need to understand what appropriate medication is used during what certain attacks or what certain allergic reactions. So, we have to be able to address the environmental factors that cause worsening symptoms. They need to be aware, again, they need to be aware of where they're at. If they're going to have a very severe allergic reaction, where they have bronchoconstrictions or bronchospasms, simply for them to walk outside during the spring, then hey, maybe you should put a mask on, or hey, maybe you should take your inhaler beforehand. Take your maintenance inhaler, not your rescue inhaler. So that could help as well, helping patients learn self-management skills. A lot of people, even adults, especially adults, kids, it's a give and take, but adults as well, you get to a point where it's like, hey, you have to be on the ball. If you're not taking care of yourself, no one's taking care of you in that sense. You need to be able to look out for your own, because as an adult, that's what you're supposed to do. And if you're an adult that has asthma, then you have kids that have asthma, then what type of leadership or responsibility you're trying to show onto them, and the health risks that can come with that as well. So, helping them learn self-management skills. Again, it's not to really bring them down. It's just simply to bring them up with education. So monitoring over the long term to assess, control, and adjust therapy accordingly. They need to have that reoccurring visits back to their PCP. They need to know, keep a diary of sorts of, hey, I used this many times. This was the situation, and so on and so forth. Making sure that they have their medication on hand all the time, full or close to it. If they're running low, they need to talk to their PCP about getting another dose, to get another inhaler there, but to just access that and to adjust their therapy accordingly. If they're constantly needing to use it, they need a larger or maybe a stronger concentration of their rescue inhaler, or their maintenance inhaler. Maybe they need to have a more rigorous maintenance therapy to treat their asthma before it happens. That's something to keep in mind of as well. So this will be the last slide, but we're going to talk about and take a look at these diagrams. So initial visit, they're coming in, they're diagnosing their asthma. They're telling the doctor, hey, this is what happened this certain day. I had to go to the hospital. I didn't know I had this. Or my little boy or my little girl, they had a certain episode. I wasn't aware of what it was until I took them to their PCP or to a hospital, local children's hospital in the moment, if it was serious. So then they are assessing their asthma severity. They'll do testing. They'll see what prior history was like, what happened during that episode. They initiate a medication, demonstrate use. They're going to come in, give you the medication that you need, and then teach you how to use it. That's the main thing. Teach you how to use it correctly. Develop written asthma action plans. Again, we're writing down what you need to have done. Like, okay, if this happens, this is what I'm going to take at this certain hour and this certain time. Who am I going to call? Where am I supposed to go? What's the nearest hospital? It's things like that. Schedule follow-up appointments. So again, if it's a kid, parents are going to manage that. But if you're an adult, to be able to call in and try to get those appointments set up to make sure that you're progressing nicely, there's no major changes in your healthcare, and then assess and motor asthma control. You're going to go help and do follow-up visits. You're going to review medication techniques, adherence, side effects, review environmental controls, what we talked about before, maintenance, step up or step down. Again, are you going to up, are you going to go down in concentrations? Review your asthma action plan, revise as needed. You might move, you might have a different lifestyle at the moment, so you need to know that that's always updated. And then schedule your next follow-up visit. Well, thank you for tuning in. This is my presentation over diagnosing managing asthma. Thank you.